Okay, so today we're going to be discussing the diseases of the integumentary system. Okay, first up we have eczema. Eczema is a chronic skin condition and is relatively common. Eczema causes extremely dry skin, inflamed skin, itchy rashes, crusting, and blisters. Eczema rashes can be located on a small part of the skin or cover the entire body. Eczema frequently appears as red, textured, and hardened patches on the skin. Thankfully, treatments exist for eczema. One of them is phototherapy. Phototherapy, also known as light therapy, involves the use of ultraviolet or UV rays on the skin. Additionally, anesthetic and antibiotic cream can be applied to the skin to treat eczema. Anesthetic cream is a numbing cream, so that can help with pain and sensitivity. And then the antibiotic cream attacks the bacteria that causes skin infections. And next up is acne. Acne is another common skin condition, especially among teenagers. It's particularly more common among them because of the hormone changes and the increase in sebaceous glands or oil gland productions. However, acne can affect people of all ages and groups, and it can be all over the body from the face to the back to. Acne occurs because the sebaceous glands or hair follicles become inflamed, infected, or clogged. There are numerous acne treatments, including over-the-counter medicine, antibiotics, retinoids, salicylic acid, sulfur, and isotretinoin, also known as Accutane. The over-the-counter products kill bacteria and limit the production of sebum. The antibiotics reduce bacteria on the skin. The retinoids and salicylic acid, so that's just like CeraVe and the various skin brands, can unclog pores and reduce inflammation. And then the sulfur dries out excess sebum and dead skin cells. And then the isotretinoin, also known as Accutane, shrinks sebum glands and reduces sebum production and prevents pores from clogging. Psoriasis. It's a long-term autoimmune disorder that causes itchy patches of skin that look like silvery scales. The patches can look several different ways, including red, scaly, spotty, and circular borders. Some even look like burns. There's no cure for psoriasis, but some things that can help are a healthy diet, relaxation, getting a few minutes of sunlight a day, and topical cortisoids or steroid creams can also reduce inflammation and itching. Urticaria is another skin disease. It's commonly known as hives, and it's a rash, and it's often a reaction to something, so food, drug interaction, or stress. It can cause severe itching. Anti-itch drugs exist and can help treat it. There's prescription antihistamines such as hydroxyzine or dinephadrine or Benadryl or Visceral. This can help address itching. Corticosteroids, it can be oral or injected, and they can help reduce inflammation and swelling. Leukotriene or modifiers like montelukast or Singulair can suppress the production of some inflammatory chemicals. Okay, malignant melanoma is another condition. It's a cancerous tumor in the skin. The tumor is dark brown to black. It's extremely dangerous and can be treated early. It must be treated early because the cancer spreads rapidly to other body parts, so you want to address that as soon as possible. It occurs because an uncontrolled growth of melanocytes cause it. The surgery is the main and often the best treatment for it. You just want to get rid of it as soon as possible. But radiotherapy and chemotherapy are also two options. Radiotherapy involves the use radiotherapy can reduce the size of large melanomas and help control size, and that's the use of radiation. And then chemotherapy uses medicine to kill cancer cells. And targeted medicines and immunotherapy can also aid the immune system in finding and killing cancer cells. Okay, seborrheic dermatitis. This is a skin condition that causes greasy, scaly patches of skin, commonly on the head on babies, and the patches appear everywhere on adults. They can appear as swollen, gray, greasy, or red. The patches can crust over and become white to yellowish. Seborrheic dermatitis is also, it's found in babies and adults, but if it's in babies, it's like yellow. Impetigo is another one. This one is commonly found on kids. It's a highly contagious bacterial skin infection. It can cause sores and blisters that may itch and burst. It like gets this disgusting yellow crust around their mouth. It can be treated with antibiotics, which is kill the bacteria, such as mucopurine or Bactrim or Retipomin or Albatex. Prescription mupirocin and an antibiotic ointment or cream or another treatment, and you just apply these a few times a day for 5 to 10 days to address this. Okay, jaundice is another condition. It causes the skin and eyes to become yellow. The condition is caused by the buildup of bilirubin in the blood. Jaundice can occur if the liver does not efficiently process red blood cells as they break down. Jaundice can signal infection or liver disease. Phototherapy, blood transfusions, cholesterol, and liver transplants are possible treatments. Phototherapy involves the use of blue light to break down bilirubin. Blood transfusions involve replacing the patient's bad blood with good, healthy blood. Cholesterol may reduce bile acids that cause itching. And a liver transplant involves removing the damaged liver and placing it with a healthy, functioning liver. Next up is tinea pedis. It's athlete's foot. It's a fungal skin infection. The fungus gets into bare feet and wet public spaces. Athlete's foot is common in people who sweat often and wear tight-fitting shoes. Symptoms of athlete's foot include a scaly rash, itching, stinging, and burning. Antifungal creams can treat athlete's foot. Chlorotrimazole, terbinafine, and miconazole are just a few that can kill the fungus. Really just look for any antifungal cream. Hydrogen peroxide is also another treatment, like 30%, and dilute it. You just apply it to the infected area to disinfect and kill the fungus. Oral antifungals also exist, such as terbinafine or fluconazole. And these can treat severe persistent athlete's foot. And there's also foot powders can help, which reduce moisture or absorb moisture, reduce odor, and relieve pain. Okay, next up is systemic lupus erythema. It's lupus. We'll just go with that. It's commonly known as lupus. It's a chronic autoimmune disease. The immune system accidentally attacks healthy skin tissue. Additionally, it can affect the mucous membranes, joints, kidneys, and the nervous system. People with lupus may have a red, scaly butterfly rash on their nose, like that. So some treatments are hydrochlorine, non-steroidal anti-inflammatory drugs, NSAIDs, corticosteroids, and immunosuppressants. Hydrochloroquine is an anti-rheumatic drug and modifies the disease. It can relieve lupus symptoms and slow down progression. And the NSAIDs and corticosteroids relieve pain and reduce inflammation. So gangrene is a skin condition that occurs when the skin dies because of loss of blood supply to the area. Gangrenes can be caused by trauma that damages the blood vessels, bacterial infections, and diseases, and diabetes. High blood sugar levels can damage blood vessels. Atherosclerosis is a buildup of fats, cholesterol, and other substances. And then on the artery wall, then peripheral artery disease. It's just results in the narrowing of arteries in the limbs, so that's going to decrease blood flow, which you don't want. So surgical debridement is one possible treatment, and that entails the removal of dead and infected tissue on the infected body part. The other one is antibiotics that can be used to combat the bacteria. Hyperbaric oxygen therapy is also an option. A patient breathes in pure oxygen in a pressurized chamber to increase oxygen levels in the affected area and promote health healing. And then amputation is the most extreme treatment, and it involves cutting off the infected area to prevent further infection from spreading.